Is collecting colostrum just a trend, or is it actually useful? I'm Jo, I'm a doula and a certified lactation educator, and I love colostrum collection. So let's talk about how to do it in a way that will actually benefit you. The number one thing I have seen on people talking about how this is just a trend and doesn't actually benefit you is people talking about collecting colostrum with a pump. And I will be the first to tell you, I do not recommend pumping. What I tell my clients to do is to learn hand expression. And I think this is why I have seen benefits from colostrum collecting where other people maybe haven't. But I always have my clients do this by hand. And the reason for that is that, one, you're unlikely to get an oversupply doing this because it's just kind of annoying and tiring and people don't do it for as long as they will pump. And two, because the actual main benefit of colostrum collecting this way is understanding how your body works, being hands-on with your own body before you have a baby to feed, and understanding how to get milk out. This makes people much more capable of latching their own baby, not just having nurses at the hospital do it for you, and just giving people a better idea of how their body actually produces milk so that when their baby is here, they can nurse them directly. The other criticism that I've seen is that when your baby is a newborn, and especially in the first few days, if your baby is hungry, you should be putting them on you to feed if you are trying to nurse, not giving them some kind of supplementation, because that won't help your milk supply. And that is true. However, not only are there a lot of uses for colostrum that are not just giving it directly to baby, but so many people are instructed to start supplementing within the first few days or even the first week. So many people. And for parents who want to exclusively feed their baby from their body, having a little bit stored already is a huge weight off of their shoulders. And by a little bit, I mean like 10 milliliters. Most people who are doing hand expression, they're just not gonna get those like bags of milk that you might see people have who are pumping and pumping and pumping. In addition to that, people who have newborns can probably relate to the feeling of feeding your baby and then 20 minutes later needing to feed your baby again. And sometimes you do not want a baby on you. So if baby can get a little bit of bonding time with your partner by having them feed colostrum while you hand express or pump, why not have that as an option? It definitely is a trend, but that doesn't mean that it's not helpful if you do it in the right way.